their friends will see them, pass by them, and literally not even recognize them because they look like a different person. They have this energy that they haven't had in 10 years.
Welcome to Cycle Wisdom Chats. I'm Mary Aline, occupational therapist and menstrual health educator, and in each episode, I interview experts dedicated to women's health. And today, our expert is Sabrina Luppino, who's a birth and postpartum doula, also fertility awareness educator, and our Vigo mind abdominal massage therapist, who has a personal experience with our topic today, which is iron deficiency. So, welcome, Sabrina.
Thank you. Thank you for having me. Excited to be here.
I'm so excited to talk about this topic because I feel like it could be the missing link to a lot of people's understanding of some of these health things that they're just like not getting answers to. How would someone know that they're deficient in iron? Like what symptoms could they be experiencing?
Yeah, well, there's a very long list, as you can imagine, and it varies person to person. And actually, a lot of people who have been iron deficient for so long or anemic for so long, they think that that's their baseline. They think that that's their normal. The most common ones would be, yeah, like brain fog, fatigue, dizzy, just overall feeling not well, just not
Mhm.
energized. Some people have headaches, burnout, or like a lack of interest in life, sleep disturbances. The list goes on and on and on. And even it can raise your body temperature or lower your waking body temperature. That could be a symptom. But there's even like less common symptoms that are maybe a bit more extreme, like vision disturbances or GI symptoms or actually passing out. If anybody has these symptoms, they should definitely seek out medical advice and go to a doctor. And if they suspect that they're iron deficient, it affects so many different areas of the body that it can be hard to narrow down. And
Yeah.
that's why I often say that it should just be a routine testing for, especially for people who menstruate. It's a mineral that we absolutely need to function for our blood production, and our body can't make it by itself. We need to get it from food, supplements, and other external sources. And its main role is making hemoglobin, which is a protein in our red blood cells.
Hmm.
And that carries oxygen through our body. So, I mean, when people think of oxygen or blood, like that seems really important for survival, right? Like it's very basic to think of oxygen or to think of blood. And our blood is made up of 50% basically of red blood cells. So if we don't have enough iron, that means we can't make enough of those red blood cells, which means we don't have enough blood, basically. So iron deficiency is kind of like you're on the road to anemia, basically. Anemia is iron deficiency that's um, gone too long, and now we're unable to produce enough. But there is different types of anemia. I also should say that. And we're talking about iron deficiency anemia here. Iron deficiency is when the body doesn't have enough iron, basically, to meet its needs. So the ferritin levels, our iron storage, will be low. And it can also impair production of hemoglobin and our red blood cells. So, like maybe the size will be smaller or something will be compromised, maybe, not always. And anemia is when hemoglobin is compromised. There is not as much hemoglobin, it's out of its range, it's a healthy range. So, we don't have enough healthy red blood cells. I've seen like case studies of people who finally get treatment for iron deficiency, and their friends will see them, pass by them, and literally not even recognize them because they look like a different person. They have this energy that they haven't had in 10 years.
If somebody is charting their cycle with fertility awareness or even just on a general app, is there anything that they might see in their cycle that would indicate iron deficiency?
Yeah, definitely. Looking out for like the heavy bleeding patterns for sure.
Hmm.
Especially if you have a heavy bleed and then you have some mid-cycle bleeding or you have a very short cycle. So let's say somebody has 22-day cycle, and every 22 days they're bleeding heavy. So definitely looking out for that. Checking for your temperature irregularities and evaluating other symptoms like fatigue, because we often write that in our charts,
Mm-hmm.
our sleep quality, mood, and energy levels.
Why is iron so important to women's health and fertility?
2 billion people, so that's 25% of our population, they're estimated to be iron deficiency anemia, to have iron deficiency anemia. And then 42% of children under the age of 5 and 40% of pregnant women are
Wow.
anemic. It makes sense why those numbers are very similar because if we have deficient mothers, the children are have a higher risk of being deficient also.
And that's because iron stores are transferred to the baby.
In the third trimester, that's when in pregnancy, iron is really needed. After birth, the placenta is still like that's why we say delayed cord clamping because the placenta is still transferring all that good stuff, all that iron. So definitely delayed cord clamping is going to help decrease the risk of having a blood deficiency, basically. So definitely pregnant people to get tested before the third trimester, and if they are deficient, seeking out treatment before that trimester because this our stores that haven't been used our whole lives are being used in that moment.
It sounds like really just important to get those like levels and labs checked.
Again, when we think of it, it's very basic. It's what we need to feel good and to feel alive. Iron deficiency can also raise our chances of miscarriage if we're in deficiency, preterm birth, low birth weight, postpartum hemorrhage. And it also can affect our thyroid function. Low iron, then perhaps our thyroid is compromised, and then we know with our thyroid compromised, then our fertility is being compromised.
What are some of the reasons why somebody might be experiencing iron deficiency?
Some reasons why someone might be experiencing iron deficiency, has iron deficiency, could be they are a menstruator and they have really heavy bleeds.
Mm-hmm.
So it's hard to keep up with the iron stores. I've also heard copper IUD as well could be another reason because it can cause heavy bleeding. Vegan or vegetarianism, which is, I know, a little controversial, but it is known to not support iron levels. Low stomach acid, that's a part of iron absorption. Just eating a standard American diet. So, a lot of dietary reasons, but it also could be situational. So, like someone had a postpartum hemorrhage and they're trying to recover. Someone has chronic inflammation or an infection that's chronic that
Mm-hmm.
affects absorption of iron, or poor gut health, another reason why we wouldn't absorb.
If somebody believes that they could be iron deficient, what are some of the next steps that they should take?
Yeah, well, definitely go to your person, your doctor, your nurse, your naturopath, whatever it may be, and tell them your symptoms you're experiencing and ask for the proper tests. So, definitely getting a CBC, which is a complete blood count. It
Mm-hmm.
tests your hemoglobin. It tests for white blood cells, your platelets, all the stuff you need to know. But that's very basic. I would add into that ferritin, so a ferritin lab, which tests your iron storage, how much iron you have stored.
Okay.
Yeah. So those two
You could
should
be
be,
having a lot of iron in your system and like read high if
yeah,
like you were just doing like a blood test, like a serum blood test, but then your stores could be low.
yeah, yeah, exactly. Yeah, that's why ferritin is is really important. You could test for just iron, which is yeah, kind of like cash in your pocket. It's like what you have available right now. But
Mm.
ferritin is really what shows us a lot. Also testing vitamin B12 in that, another basic, like the yearly tests, the yearly labs, I think for menstruating people to be doing is CBC, ferritin, B12 in terms of iron, right?
Hmm.
Those
Hmm.
are the basics.
So if you've been getting value from this video, please hit the like button and share a comment about your own experience with iron. Have you experienced iron deficiency? Do you think you might be iron deficient? And yeah, let us know in the comments.
I know that blood donors only test hemoglobin. So like if you're donating blood, they're not going to test your ferritin and all the necessary. They're just so you could be iron deficient and donating blood, you know. So it seems so bizarre, but I know some places don't test for all the things that we need. But in terms of just getting your basic needs daily for iron, eating things like organ meats, taking it with vitamin C or with a food that has vitamin C in it, because that increases the chance of absorbing it, and not having anything with calcium around that time also.
Mm-hmm.
Calcium will always win in our gut. So we want to eat iron without calcium.
Okay.
And yeah, things like sardines, red meats, organ meats, oysters, cooking on a cast iron pan. I would say those would be like the basic lifestyle recommendations. They say if you eat a portion of liver a day with good fat, it gives you all your recommended amounts of iron for the day. So I know that's not everybody's cup of tea eating liver, but it's definitely not mine. But if you are eating something with high iron, or you're taking iron supplements already, or you think it's the right treatment for you, taking it before 1 p.m. is going to increase your chances of absorbing more iron. Not to say we shouldn't eat iron rich foods throughout the day. We definitely can and should. But before 1 p.m., our body has a increased chance of, yeah, absorbing that iron.
That's one thing that I learned in your class too, was timing your supplementation can actually make a big difference. So you have a personal interest in this topic. Can you share a little bit about your own story with iron deficiency and anemia? What sort of care did you receive? At what point did you figure out that you needed care?
Yeah. Yeah, sure. I, well, I was vegan and vegetarian for like 9 years, and I felt it was part of my identity, and I understand why people are doing that. Yeah. And I went to the hospital because of extreme fatigue originally, and I got tested for my ferritin, which is great. They tested for the right thing. And it was at a 4, which is like severely low, as well as my cells had shrunk, and I was definitely being compromised and affected
Wow.
by this. I wasn't technically anemic though, so they told me to go home and take supplements. And I didn't, I went home and I didn't take supplements. And I just got worse. And I ended up back in the hospital for different reasons. I was super dizzy and now like had a fever and just wasn't well. And they did give me an IV of iron. But looking back on it, I know that it was too much iron. And for
Mm,
how unwell I was, it wasn't the right thing to do, because it
mm,
caused more stress in my body. And yeah, it caused a lot of problems, and it was a mess, and it was a long, long journey to get out of that. I got a chronic infection, and I'm still healing from that.
wow.
Um, but now my cells are back to normal size, and I'm like a 30. My ferritin's at a 30, which is still low, but I've gotten an infusion and supplements and all the things, so I'm on the road to the optimal levels. But yeah, it really showed me that they really don't take it seriously, especially if you are not anemic. If you're just
Mm,
iron deficient,
hmm.
um, they don't take it as serious.
Thank you for turning that experience into knowledge that you can share and support other people with. If you are interested in learning more about iron deficiency and anemia, Sabrina gave a really great class on this, and the link will be listed in the description notes below. If you want to consult with Sabrina or you find yourself on Salt Spring Island in Canada and want a one-on-one session, you can reach out to Sabrina. I'll link all of your details in the show notes. And thank you so much for joining me today.
Thank you. Thank you for having me. That was so fun.